Sure.
Good morning, everybody. Happy Friday on this beautiful day. I'm Brooke Lovelace with the Iowa Developmental Disabilities Council. Welcome to what we thought was going to be the last day of session. I think maybe some people were praying this was going to be the last day, but they didn't get it wrapped up. So it looks like they are going to go into next week, but we do still have a lot to cover. There's some budget information and a bunch of good information to go over today. So with that, I'll turn it over to Amy.
I muted myself. Thanks, Brooke. Hi, I'm Amy Campbell, and I'm just going to kind of go through budgets and policies, and Carlin's going to join me here off and on through it, just to kind of give you a snapshot of where we're at right now. Again, like Brooke said, this was supposed to be the last day of session, day 110, but all that means is they are paid for 110 days. So now they're working for free and they don't have staff. So they can still keep working. They can work as long as they want. They just have to pay for their hotels and meals and everything else out of their own pocketbooks. So I do think they're going to be done next week. We're in a pretty good space. So there are still a lot of things that are still in the works. And so I'm going to start it with budgets, because that's where
Amy, you muted yourself again, I think.
Sorry. Where we started with the budgets, you can see the current fiscal year budget, the year we're in right now, is 8.2 billion. And this red line item is where the actual number where we ended up with the joint budget agreement is 8.52 billion. That's a 3.7% increase. Again, I think we mentioned this at the last capital chat. We are allowed in the state to spend 99% of the money we take in, but this budget only spends 89%. So you can see from the math in the corner that we're not spending a little over $1 billion. That money will go into a taxpayer relief fund that they're going to use to cut taxes. So you can see that if legislators wanted to, they're legally allowed to spend more money on things like getting rid of the waiting list for waiver services, or adding new scholarships for kids that are going to go to college. Whatever your priorities are, there's still a lot of money left on the table this year that is not being spent. This is a long slide, and again, we'll have these in our report this week that'll go out on Monday morning. So you'll have this in writing if you want to go to our website. If you don't get it by email, you can find it on our website under This Week at the Capitol. But this is kind of the breakdown of the budgets, and I highlighted the three where we have a lot of items that we're looking at because of how things were reorganized this year. Vocational rehabilitation is now in the economic development budget. And the Medicaid budget, of course, is in Health and Human Services. And the education budget has things like the AEAs. It's a lot of the health professional loan repayment programs, as well as where we wanted to see some money for the post-secondary transitional scholarships program, which are those scholarships for like the REACH program at the University of Iowa. And so you can kind of see where those budgets kind of broke down. Transportation always spends 0 state dollars because it's money from the road tax fund, which is like your gas taxes. So it doesn't really show up on the budget. But just a few highlights of these. Sorry. First, you can this slide just shows you where each budget is at. And I will say that, the things are in pretty good shape. Those Senate files that are already in the House are good to go. We just don't have we have not seen the infrastructure budget or the final bill, the standings bill. But everything else is in pretty good shape. They're still working on an agreement for economic development, education, justice systems, and the judicial branch. So those are the ones that are still kind of hanging out there, trying to get agreement on. But there is agreement on the Health and Human Services budget. So the Senate debated that on yesterday, and the House is getting ready to debate it on Monday. So that should be done pretty soon here. And I wanted to highlight a few of the things that are in that bill. First of all, you might recall last year, the legislature increased home and community-based services waiver programs rates and habilitation service rates. But they used federal money to do that. So they had enough money to get us through about 18 months, which means we had to pay a little bit to have the full year this next year. So this is a quarter of what it'll take to keep those rates at the rate they're at. Sorry, I got distracted by my cat. So that might not have made as much sense as I thought it did, but basically they needed to add state dollars in there to keep the rates the same. So that'll get us through next year, but the following year it's going to take over $20 million to replace those federal dollars they use. So that's why they don't usually like to use federal money, because they know they'll have to replace it with state money to keep them there. But right now they're sticking to their commitment that they're going to make sure those rates are sustained. And those were pretty good increases last year. This year they also really focused on mental health and increased mental health and behavioral health services by $13 million. I'm not sure where exactly that's going. They left it up to the department to determine which rates are going to increase and by how much. So community mental health center rates or psychologist rates. We're not sure if it's going to be by code or by provider, but we know from the Department of Human Services, they have a list of rates that are behind other states, including our border states. So those are the ones that they'll probably focus on first. There also is a long waiting list for public guardian services, and those are in the former Department on Aging. So now it's a part of the Health and Human Services Department. And they estimated it would take about $500,000 to take people off the waiting list and meet the demand for that service. But we all know that once you take people off waiting lists, other people might realize that the service is available and want it. So we'll be watching that closely to see if that really does take care of the need, or if there's more money that's needed to meet all of those requests. There's also a $15 million increase for nursing home rates. And those, when they're matched by the federal money, are $44 million. So there's a lot of controversy about this, I'll just say. A lot of people have wondered why we're investing in nursing homes when we should be investing in community-based services. While others are saying we've lost a lot of nursing homes and we need to provide more money to make sure that they stay available in the rural areas. So, but that's agreed to right now. It also is creating a special fund to put money in from if they sell Glenwood or any of the resources at Glenwood. That money would go into this special fund that would be used to invest in other Health and Human Services institutions. So I know that Medicaid has talked a lot about wanting to make sure they don't get into future trouble with the Department of Justice, and that they make sure that their institutions are meeting not just the letter, but the spirit of the ADA. So I know that they wanted to have that fund available so that it can make improvements at the MHIs, at Woodward, and potentially Eldora, which is a juvenile home. um, to help make sure that they're meeting all of the needs of the folks that are in them. Of course, they haven't sold Glenwood yet, so I can't tell you how much they would get, what kinds of things they could sell. And so that's kind of an unknown at this time. And they of course wouldn't do that until individuals have moved out and are in the community or in their new settings. Also something that was added yesterday that hadn't been talked about since the very beginning of session is allowing Medicaid some flexibility to increase dental rates. A lot of talk about dentists not taking Medicaid patients because the rates are so low. They allowed in the budget DHS to, or HHS, sorry, to increase those rates as long as they do it so that it doesn't cost any more money. So that's kind of confusing, because one of the things that HHS recommended was paying better for preventive services and maybe eliminating some coverage on other services. They say that Iowa has one of the best dental plans in the country, and maybe we should not be as generous with what we pay for in that plan. So of course that's concerning. They have a work group that's been working on this, so we'll be watching how this gets implemented, or if it gets implemented. But we do have some things on our website that explain kind of what they were looking at with those dental rates. But again, that was back in late January, early February when they presented that. I'm going to pause for a second to see if people have questions about this page before I move to the second one. There's still more to highlight. Okay, I'm going to move on, and then if you think of something
Amy?
here. Oh,
Amy,
yes.
I did have one. So I just wanted to ensure that the promised HCBS rates would maintain, and you said that was a solid pledge.
Yes, it was. Both House and Senate were very committed to that. There was a little bit discussion about using another source of money other than general fund. But quickly they decided that it was better to use general fund and start that moving toward that. Because that's of course the most sustainable.
Okay, great. Thank you.
Yes, they are committed. So $5.5 million is roughly a quarter for 1/4 of the year. So next session, we'll be asking for $21 million instead of 5.5, just to keep things at that level. But I have some news about where they might have some more money. So hang in there. So there was some language added to the budget as well. So this is still the Health and Human Services budget. They're going to allow the Health Policy Oversight Committee, that's a legislative committee, to meet annually or not at all. Right now they're required to meet twice a year, and they started off meeting twice a year during the interim, and then the last couple of years have just been calling one meeting the morning session and the second meeting the afternoon session. So really they only met one day. But now they're saying they can decide whether or not they want to meet. I will say from my perspective as an advocate, a lobbyist, I like having them meet during the interim because I get a lot of news from Medicaid on what they're doing, what the MCOs are doing, and there's an opportunity for public comment. You don't have that during the session anymore as much. That we don't have a lot of budget subcommittee meetings when you get a lot of that information, and then sessions only for 4 months of the year. So the rest of the year, you don't really hear that kind of information. But then again, the DHS has been doing the town hall meetings monthly. So that's another source of that that type of information too. So maybe that'll be enough for legislators. I don't really think they participate in those monthly meetings, but I always like having the Health Policy Oversight Committee meet, but we'll see if they meet this summer. They also did something very important, something that I know Carlin worked hard on, is to emphasize that the bill that they passed on public assistance reform, they called it, was they didn't make it clear that the household asset test didn't apply to Medicaid. And they kept telling us it didn't, but the language wasn't clear. So they did add some language into the budget bill that clarifies that the household asset test only applies to SNAP, the Supplemental Nutrition Assistance Program, which is what SNAP is called. So that Medicaid still and children's health insurance programs still have to go through the additional database tests and the identity verification that was in that bill, but the household asset test is only for SNAP benefits. So that's still concerning because a lot of people with disabilities receive SNAP benefits as well. So that's something we're going to keep watching. That other bill has already been sent to the governor. It hasn't been signed yet, but it's been sent to the governor. Along that line, they also created a new public assistance modernization fund, which uses $8 million of the Iowa Total Care settlement to create a new portal that would allow somebody to come in and figure out what services you're eligible for and apply for them at that one time. So you wouldn't be jumping around to different agencies trying to find out if you're eligible for a program, what programs they have. This would really help qualify you. Of course, this is also where they're going to verify who you are, do the asset test and all that other stuff. But it is intended to make things easier for people to apply for benefits and figure out if they're eligible. This total care settlement, it's from a lawsuit that the prior attorney general, sued Iowa Total Care over some pharmacy benefits things that they did. It's a national thing. They did it to all the states they're in. So it's a $44 million settlement, and they're using $8 million of it for this. I'm told the rest of the money is it's specific to how it has to be used. So I don't know a lot of information about what else it could be used for. There also have some language in there. This was a big issue for the Community Providers Association. Cities and counties had been regulating waiver homes like they do a facility. So it would require them to put in really costly sprinkler systems into a home that has 3 or 4 people in it. That's just a residential home. Those are already required to have smoke detectors and other things, safety features. But these sprinkler systems are like $100,000 to $200,000. So it really adds to the cost of creating homes that people can live in the community. So they're basically telling cities and counties they have to regulate them like they would a home, not a healthcare facility. 2 other budgets have some money in it we wanted to call your attention to. There's a $50,000 increase for the Farmers with Disabilities program. That's an Easter Seals program that supports and provides help for farmers who are disabled so that they can continue to farm. And then $150,000 increase for vocational rehabilitation. And as Carlin and I found out, that's a $3.7 million match, or 3.7 for every state dollar, it's matched by $3.70 of federal money. Is that right? Yeah. So you can see that that's a pretty good investment if you can, for every dollar we spend here in Iowa, that we can get $3.70 of federal money for it. So you can I didn't do the math on that one, but quickly adds up. I think that's my last budget slide before I go to policy. So I thought I'd pause here and see what people have any other questions. Didn't see a lot of cuts in the budget, so it's either status quo, same level as the current year, or these increases we talked about here.
And
I
Amy,
forget-
you might want to mention too, there was a lot of support for this bill among advocacy organizations and a lot because of the mental health funding increase. Is that your analysis of that?
I'm sorry, I didn't hear you very well.
Oh, sorry, there was support for this budget bill with a
Oh.
lot of the advocacy organizations, and we're assuming that it was due to that there weren't cuts, but also for the mental health funding increase.
Yeah, I think the two things that were the biggest in pulling support for people were the commitment to continuing those rates that they made a commitment to last year. So the HCBS rates, as well as definitely the 13 million, because this comes on top of a couple years of increases in that area. And HHS had a study that showed we are really, really behind other states. One example was a psychologist gets $70 in Iowa for their service and $144 in Nebraska. So if you live over in Council Bluffs, why would somebody serve people in Iowa if they can make double that in Nebraska? So it becomes a real workforce issue for people too. I think we have a question, Lori. You can unmute yourself. I think or I can try to do it.
Got it.
There you go.
Okay, I got it. My question was pertaining to the use of technology. I became aware at least a year ago, if not longer ago, that there are plenty of people that are using technology to their advantage to conduct virtual mental health visits, okay, and charge back to a consumer or a family, whether it be a minor child or a guardian situation, or whether it be an adult to another adult. Do you know anything about that? I mean,
No, well, I know there's a lot of people that are using telehealth, but
right.
no, I don't. That's specific in the charging back. Harlan, have you heard anything about that?
No,
Or
I
Brooke?
haven't.
Yeah.
Well, that gets charged back to the government. That would be my point here, is that gets charged onto Medicaid and or those kinds of services. So
Yeah, I think there is, I know from the mental health provider community, they want to be able to provide telehealth services to people that want them. And they've got a lot of cases, like snowy winters. It becomes difficult for any of us to get out of our house sometimes and go to an appointment. Not just, other transportation barriers, or you're working, so you want to do something over your lunch hour, but you can't drive 3 cities over to where there's a provider. In those situations, it's been very helpful. And I think they've lobbied successfully to allow for telehealth reimbursement. I think where everyone gets concerned are these big California companies who have people that are not Iowans providing services, and whether or not they're connected enough to help with those wraparound supports. I know that there's been concerns about that, or the tech apps, you know, uh, they've got apps. I can't think of what they're called now that you could use. Michael Phelps is one of the people, the swimmers that's selling one of them, you know.
Oh, yeah,
But I know that there's been some concern about quality
exactly.
in that terms. But I think that's probably a national challenge a little bit that's going to have to work its way out everywhere. You know, we were just talking about to the interpreter about how more and more Zoom is now realizing they need to make some upgrades to allow for the interpreter to be seen, you know, by everyone. And so I think a lot of things that came out of the pandemic are still being sorted out. And I'd probably put that as one. I know the Senate is very concerned about quality with mental health services. And right now we have such a shortage. People are wondering, is it better to just get something and maybe focus on quality later? I don't know. I don't know the answer, but I think that's one thing that legislators grapple with is quality over quantity or quantity over quality.
Well, a lot of the legislative things that you read about in the newspaper are virtual meetings, so that it's from the convenience of their own apartment or home or what have you. And that can be a person who's been elected to be a mayor, a mayoral candidate, you know, in a city, who usually is also active in a law firm and so on. But he's got a family, you know, as well.
Yeah. Well, and I
So
know that
that's why it's a concern.
yeah. I know there's also people doing some innovative things. I know Easter Seals is doing some home electronic monitoring to help with electronics to help because they have such a workforce shortage of visiting nurses that they've successfully implemented some electronic monitoring. And that sounds creepy and big government, but that's not what I mean. I mean, there's like different devices that they can use that can help with individuals if they can't get to them as frequently as they need to. And I know that's been a pilot project that they've been working on. So I think a lot of that is something that we're going to be watching in the future. I'm going to go ahead and move on to some of the policy bills. You probably have seen these. These are things that have been completed that we've been watching. You know, the private school bill, the educational savings accounts, we talked about a lot early in session. The government reorganization bill, that we talked a lot about at the beginning and middle of session. And just recently, 3 other bills were sent to the governor. I mentioned the public assistance reform bill before. They also just sent the parents' rights in education bill. That is Senate File 496. That's the bill that has things like a required citizenship test for kids, a very detailed list of parents and students' rights. You can't talk about sexual orientation or gender identity in elementary school. It sets up an ability to ban books that have any type of description of a sex act in them, including in high school libraries. There's just a ton of concern about that and how it's going to be applied. You know, it's a pretty big bill. So that is on its way to the governor, as well as the bill that was a HHS bill. It adds more people to the regional governing boards. I should not say more. It adds a better balance of people, a better mix of people to the governing boards by requiring that there be law enforcement on those boards. They already have education member. It allows providers to vote, and it limits the number of elected officials, those county supervisors, to half the board. So it really gives stakeholders a stronger say on those boards. And it also adds a new service that's required of the region. A competency restoration that's community based. So right now, if you're if you've committed a crime or suspected of committing a crime and they don't think you're competent to stand trial, your only really option is an MHI. So this would create a community-based option for that in hopes of trying to help people faster because there's not enough space or not enough capacity at the MHIs. So that bill got sent to the governor. There were also a couple of resolutions adopted. We talked about the Disability Awareness Month that was adopted in March. But the other one is an update to the Iowa Constitution. You may not realize this. I didn't before I saw this, that the Iowa Constitution still has age 21 as the voting age. Obviously, that's very outdated. So this just makes that change. So it's consistent with what the law is now, that you're guaranteed the right to vote at age 18. So that has now passed twice. It passed in the last General Assembly and it passed this year. So you will see that on your ballots next November 2024 during the presidential election. You'll get to vote and decide whether we should update that. So not as controversial as some of the other constitutional amendments you've seen, but going into the ones that are still in the works, this is my opinion. So I might be wrong on whether it's a good chance or bad chance of passing, but that's just my inclination right now. There's a bill that requires the Your Life Iowa and crisis text line and crisis phone line to be on student ID cards. So if you issue a student ID card, you would add that on there. That has passed the Senate and is back in the House with a small amendment. So if the Senate takes that, it'll be on the way to the governor. I mentioned money in Medicaid and other options for sources of money. Right now, MCOs don't pay the insurance premium tax. This bill would make them pay the insurance premium tax. And then the state would then collect that and give it back to the MCOs in their contract, but in so doing, they match federal funds. So it's really just a transfer of money. They do this with hospitals and nursing homes to pay more, to get them more, to help pay for their services. It doesn't cost the state anything. It doesn't hurt taxpayers. It just pulls in more federal money. And so doing that, we're going to generate $100 to $120 million a year. So I mentioned, $21 million is needed for a full year to sustain those HCBS rates. That's one way they could pay for it. We also know there's a big cliff coming up where we're going to have to do some things to comply with whatever the Department of Justice tells us to do with the Glenwood settlement. So there'll be another consent decree that will tell us what we need to do, and we'll have to have a plan in place. And we know that's going to cost a lot of money. I've heard $100 million. So that's another option there too. So that bill is passed the Senate. They had a small bill amendment that's gone back to the House. They also are increasing child care assistance eligibility to 160%. But doing so, they added 4 more hours of work requirements. So somebody is going to have to be in school or work for 32 hours instead of 28 hours a week. And that's averaged over a month. They didn't change the work requirements for those kids that are in special needs child care assistance. So that's a positive. They also increased the rates a little bit for the half-day rates so that people could work part-time and still get childcare assistance. The things that I think are going to have a little bit more trouble passing, I kind of don't feel like they've got enough consensus yet on them to move. One is the bill, House File 604, that removes disruptive students from classrooms. Right now, the Senate wants to include the ability for the school to expel disruptive kids. But they also say a kid on an IEP or individualized education plan wouldn't be subject to that. They instead would have their team call a meeting to change their plan. But the House wants to have a process that doesn't include expelling the kids, but would allow somebody to move the child to an alternative learning environment, like the therapeutic classrooms that were passed a few years ago for this very purpose. The Senate wants to include just threats of violence from a student, not actual acts of violence, in being able to expel them and go through this process. So the House and Senate are just not agreeing on how they want to do this and what the approach is. And so that's why I have that in this section. They're far enough apart that they could just very well say, let's leave it till next year. I don't know, Carlin, you've been following this pretty closely. Do you have a better feel for that?
Can you hear me okay?
Yeah.
Okay. No, I talked to the AEA lobbyists about this because they were helping us determine if, students on IEPs would be affected and how they would be affected, and if it's in violation of ADA to remove a student from a classroom. And they seem to think that with the amendments that came in, but then went back out, Amy, is that how you understand it? That would fix that. So I think, we still have some concerns about this, and I think others do too, who are concerned with this part of it, much less some of the other aspects of implementing this. So, Amy, your guess is better than mine, but that's just what I've heard.
Yeah, I think it's still pretty 50-50, depending on if they get agreements on everything else and they can't get an agreement on this, they might walk away from it. If they have a little bit more time, they might work their differences out. The other one is seizure ready schools. So this is House File 608, and it is in the Senate. It's the bill that requires schools to have a seizure plan in place and have somebody trained to identify and react to a student having a seizure and being able to provide the necessary medication at the school. And that could be a nurse, or it could be somebody else or a team trained in the school. I think this should be a slam dunk, but the schools are already really wanting to have a review of all of the different healthcare mandates that they have, that they are scared that adding a new one just kind of messes up that plan to review all of those healthcare plans or requirements. I think that's really the sticking point right now. I don't think the schools think it's a bad idea. I think that they just feel like one more thing on them is just too much. And as you've probably seen in the news, schools are going to have a lot they have to comply with in this next coming couple of years with the new laws that are coming out. So I think that's the only reason. It's really not the policy of it. It's just the practicality of the timing of it, which is too bad because we're pretty close this year and farther than that's ever gotten before. Property tax relief, everybody got their property tax assessments on their homes, and if you live in Des Moines, the average is like 23% or something like that were increased. That means your tax bill is probably gonna go up. Legislators have been hearing from a lot of people, but their plans, the House and Senate plans, are so different, and it's really complicated that I'm not sure if they're going to be able to reach an agreement this year. One thing they might do is just make your property tax bill a little clearer so you know where all your money's going. I know that's a big piece to what they want to do. They want to have property taxes be more predictable, and they want to have people know more about where their money is going. How much goes to the city, how much goes to the county, how much goes to schools, community colleges, and all the other things that are in your property tax bill. The things that I don't think are going to pass, one I think Carlin will be happy about because she testified against it, is House File, see my number 7, is it 716?
Yeah.
My picture is covering it up. That limits the participation in the Iowa caucuses, which of course are coming up at the beginning of next year. While the Republicans are still first in the nation, Democrats are not, but it would require you to be registered to vote and be registered as that political party, so a Republican or Democrat, to participate at least 70 days ahead. Right now, you can register there. You can change your political affiliation there. I could go to a Republican caucus, and if I'm an independent, I would switch to that. I could go to a Democratic caucus and switch to that. Whichever one I wanted to, you could switch right there. You wouldn't be able to do that anymore. I think probably the bigger piece is that you must participate in person. We know the Democrats have been trying to figure out how to get generate more participation by allowing some kind of remote or mail-in preference, and they wouldn't be able to do that under this. Caucuses are usually a Monday, Tuesday night at 7 o'clock. So that becomes really difficult for people that may rely upon somebody else's car or a staff person to help them go, or childcare. And of course you have to be there on the dot. Like if you're there at 7:01 and it starts at 7, you cannot participate. So they shut and lock those doors the minute that clock turns. So those are all challenges to participation, and I don't think this bill is going anywhere. It's on the House calendar. For whatever reason, it came out of the Ways and Means Committee, which is a tax committee, and there's no tax in this bill. So I think there's a lot of issues with that. There's also a couple of bills that have been sitting around since the first funnel and haven't moved, that basically state that mental health, behavioral health, and brain health are all the same thing. When you add that to code, it gets complicated because you have, different uses of the terms, and they're tied to different payments and programs. So I think there were a lot of questions that came up on this bill, even though people think it sounds like a good idea. There were just some real practical concerns that I don't think will allow this bill to go very far this year. I think it's gonna die. And then of course, Carlin was trying really hard to get some money for the educational scholarships for like the REACH program and the next program up in Northwest Iowa. She's still working on it because the education budget is not agreed to yet, but it's looking like it'll be a miracle if it gets done. But vocational rehabilitation said that if they funded the program, they could match it with that $3.70 federal match and really, generate some additional dollars, but that might be tough. Okay, so I should ask any questions on those. Is there something in the chat? Oh, yeah. I'm going to turn it over to Carlin when we ask what's next.
Well, thanks for all that info, Amy, and I'll let you rest your voice for a little bit. And we can come back and take more questions at the end if you think of things about what's going on this year. But we wanted to talk about what's up next for next session, even though we're not quite wrapped up with this one. We certainly have a lot to analyze and think about for the next session coming up. And as Amy mentioned, well, I don't know if you mentioned this, Amy, but we've talked about this before, that bills that were introduced this year and did not make it through the funnel have the opportunity to be debated next year if they are revived, so to speak. And I know that there were a lot of bills this year that were introduced. I actually talked to someone in the Legislative Service Agency about how many bills there were this year and if there were more than previous years. And they said there were a lot, maybe not a record, but they're actually thinking that next year, because we had so many freshman legislators this year that didn't quite know what they were doing yet, that they're actually thinking that next year we might have more new bills introduced once they kind of get the hang of the way things go. Of course, the other thing that we're seeing is that anything that's introduced by the minority party is not going anywhere. So, you know, one of the things that we all need to work on as advocates is reaching out to our legislators and talking to them about our priorities, no matter what party that they're with. But particularly if they're in the majority party, we have a better chance of getting things passed, or at least brought up, that we're interested in. So one of the things that we talked about this year was asking legislators, and we made this the theme of March being Disability Awareness Month, asking legislators to work with people with disabilities as they're making decisions and proposing laws, rather than working for us. And that was, you know, the DD Council, our role is to assist you as advocates in learning about processes and systems and issues, and help you advocate for yourself and your loved ones and others with disabilities, so that we can make policy change and make change, you know, in other ways too. So this year we kind of focused on legislators and asked them to, as they're considering legislation and putting bills together, to reach out to people who these bills are going to affect and see what effect it may have on them. And that still is it takes our effort. So for the coming years, I don't know if you can click Amy ahead, because I don't think I can. We want you to consider reaching out to your legislators, especially over the summer. There's a few ways too that we can help you with that. And the other thing that we will be asking you all is to help us consider what our priorities will be for next year. So knowing that all that's happened this year, and Amy just went through a lot of things in detail, a lot of budget detail, which we don't always, you know, get into that much detail when we're advocating, helps us see the granular picture as well as the big picture budget wise. So there's a lot of little things that we could get into, but, you know, big picture wise too, you know, what are the changes that we still want to be made? And the more that you can get yourself in front of your policymakers, then the more they're going to reach out to you for information and for comment, and, you know, just hopefully hearing the message that people want to be involved in the process if what's being proposed is going to affect them. So that was part of our having a seat at the table message that we proposed this year. And some ways that it also came to light were in some of the discussions of state government reorganization, when the Department of the Blind was not, they were well represented in public hearings, but they did not accommodate for them in the meetings. The legislature did not. And the deaf community was not accommodated for in all meetings where considerations about their, you know, things that were in the budget for that would affect them are coming up. So I think it came to light in ways that, you know, were very uncomfortable for legislators, and we can use this as examples to say how we want to help people be involved in the future. So if you could click one more time, Amy, a couple of ideas for ways to get involved. This is not on the list, but one of the things that we have available for advocacy groups is grants to have town hall meetings, which we would be delighted to help you set up. in your area, and to help get legislators to come to a meeting and talk to advocates. And it's an opportunity to ask questions, to have dialogue, and we have funds available to help you, and technical assistance to help you set those up. So please consider that. We have information on our website. And then a couple of events coming up this summer. Our Youth Leadership Academy is in July, and this is online. And it's for youth, young adults, high school, just during transition time, early 20s, that want to get more involved and want to know more about how to be a leader and how to work with mentors to be independent, to gain their independence, and to also just self-advocate. So it's a wonderful opportunity to spend kind of a few hours during the summer with us and kind of build skills that last a lifetime. So that application is on our website too. I think Brooke just put it in the chat. And also the Make Your Mark conference, which is our advocacy conference, is coming up this year in August. The registration is not available yet, but please mark the dates. And it'll be at the Coralville Hyatt. We have some great guest speakers and breakout sessions that we're planning. So it's a great way to network. We also will have legislators there to talk about policy and advocacy issues from our advocates. And we really hope that you can join us for that. So that's all at iowaddcouncil.org.
And Carlin, if I could just interject there too, we are not, it's not open for registration yet, but we are looking for exhibitors and sponsors. So if you would like to exhibit at our conference, you can go to our website and find that information, but we'd love to have you at our conference as an exhibitor or a sponsor.
Thank you. I think that was our last slide. Does anybody have questions? Our next Capital Chat coming up is on a Thursday, because Amy has some very important events coming up in her life that we needed to get away from on Friday. And so it's Thursday, May 18th at noon. And we'll also talk at that time about what's going on in Congress. There's things going on at the federal level that are important to our community, and we will be sending some information about that out too before May 18th. But we'll get a little bit more into federal legislation at that time, and also do hopefully a final wrap up, right, Amy?
Yeah. I would hope so. Yes.
I would hope so. Yeah. Or else they're going to be, yeah.
Things have really gone wrong if they're still in there by 8 to 18th. Something's really happened.
Yes. I need to be done by the time my oldest graduates high school. So that's the 23rd. So yes.
Yeah. So if anybody has any more questions, we have a few minutes left.
I'll go ahead and stop sharing so we can all see each other. Everybody wants to go outside. Have their lunch outside today. Beautiful.
Looks like a great day before it rains, because it's Drake Relays weekend in Des Moines, which means it's going to probably pour soon.
That's right.
Or snow.
Has anybody heard that it's going to rain?
It is tonight, I think.
Really? Well, enjoy the day then, because I thought yesterday and today were the only 70-degree days that I had seen, like a few days ago in the long range. We're still at that kind of unpredictable time of the year. Even in Iowa, I've seen snow in May.
Oh yeah. It
Freezing
snowed-
overnight temps.
I remember several Drake Relays where it was snowing. That's the end of April, beginning of May. So
It seems like it's always raining. But tomorrow I've got a nephew that is supposed to be running in it. I've just never been. I don't like fighting those kinds of crowds and trying to find parking space. I imagine you pay a fee to get in and watch.
I don't
Yeah,
know,
and
Carolyn used to be on faculty, so.
Yeah,
So
we go-
who was faculty?
I worked at Drake for a while, but we've always gone to the relays, and it's the crowds aren't too bad.
Really?
Yeah, it's a fun time so long as the weather's great, because if it's raining, you can't bring an umbrella in the stadium with you, so you just have to sit there in the rain. Um,
Oh my God, yeah. So you want like some kind of cover-ups, like you want a hooded something? Yeah.
Yeah,
I'm
today's
cold in
the,
my house.
today's the Paralympic, the wheelchair races. They're trying
Yes.
to encourage Paralympic, sports, so.
we're actually missing it right now, is at 11 o'clock. But there's one tomorrow that's new. It's 100 meter Paralympic wheelchair. That's a new event, so that'll be fun to watch.
Cool.
Don't they do that with who was it? We had a Mark Reed that was an affiliate. Do you recognize that name? He was involved in not the Paralympic. What's the and
Oh, Special Olympics.
yes, I think it was.
Yeah.
I think it was the Special Olympics. What was his wife's name? Christine. But then I think they divorced. They had been a combined household marriage, I think, from the beginning, but I'm not sure. So, yeah, and Easter Seals, they probably have programs like that too.
Yeah, adaptive.
Would they have entrance, people that they enter into the program, yeah, at the races.
Right.
The relay races to involve them in the community.
Yeah, the adaptive races are getting more popular, which is awesome.
Mhm.
All right, well, thank you, everybody. Thanks especially to our interpreter. We appreciate you and being here for us. And hopefully we'll see you in May.
Thanks, everybody.
Yeah. Bye. Adios.
Bye.
Leave the meeting.